What you don't know as a patient is when you enter the hospital, someone is checking your skin. They're using their eyes to say the skin is intact and it looks healthy, but at the same time, how can you expect them to see something that you can't see with the naked eye? I'm Karen Cross. I'm the CEO and co-founder of Mimosa Diagnostics. So before Mimosa, I was a surgeon, a key opinion leader in the area of tissue injury or wound care. As I started to become more interested in wounds, my own family member then started to have trouble with his legs. We were going through this process as a family. I realized that in my practice in seeing these patients, I had to change how I looked at the problem clinically. And it was really in the moment of my mom sending me these pictures and saying, what should we do about this? That I realized not everyone has me in their pocket. And that's where the idea for Mimosa came from. So Mimosa is an imaging system where we use a device that attaches to the smartphone. By using novel wavelengths of light, we look below the surface of the skin at what we would call biomarkers that help determine if you have a skin injury or not. So the Mimosa device is a ring of LEDs. They shine at specific wavelengths, looking below the surface of the skin, and each of these wavelengths tune to what we're looking for in the skin, so it's very specific. We also have our own imaging module, so our own camera system that's collecting all this information, and an infrared camera that looks at temperature. Let's just talk about diabetes. So people with diabetes have poor circulation to their feet. Something as simple as a tight-fitting shoe, they don't feel it, they get a blister. That blister could lead to a hole, that hole could lead to an infection. If that ends up not being caught early, that toe could be amputated, that leg could ultimately be amputated, and the infection can also spread, not just from that wound, but to their entire body. And people die from the infection as well as from the amputations. What the Mimosa enables us to do is to show them in real time, look at the surface of your skin, look where you need to wear your shoe properly, or how this product is actually helping you heal. Big category of technologies that we live in is something called optical technologies. Optics just means light-based technology. We've known that they can only be used in Caucasians. In fact, the whiter your skin, the better the technology can read the results. We decided not to put something into market until we solved the problem for all people, not just for one type of person, and so for all skin tones. Am I going to sit here and say that it's perfect? It's not perfect, but it's best in class currently right now in the market, and we only have one way to go, and that's up. When I started building these devices, it was almost 15 years ago. At that time, we would put 7 computers together. It would take 3 hours to collect the data, and the machine was 200 pounds. And for the first time, what we hear from the patients is that they feel powerful or feel a part of their care and their care team. If you ask me now what I think is possible for the future, I think it's limitless.